Hey there! If you've lived in certain places in the US in the past couple of years, you're likely to remember times when smoke in the air turned the sky orange. If you didn't live in those areas, you likely saw photos or heard stories in the news. Today, we're going to talk about wildfire smoke and how public health experts can understand and track the impacts of wildfire smoke on people. Wildfire smoke is a mix of gas and particles. The really small particles are called particulate matter, or PM for short. The ones that measure 2.5 micrometers or less are so tiny that they can get into the small spaces in the lungs. They can cause cardiovascular or heart and blood vessel damage and make existing conditions like asthma worse. These problems can even cause people to go to the emergency department. What we don't know is what impact prolonged exposure to wildfire smoke has in people, or how to predict those impacts. So, to help learn more, scientists used the Canadian wildfires in April through August of 2023 as a case study to investigate the impacts of wildfire smoke in the US. These scientists then used this information to create health messaging around wildfires and your health. But how did the scientists complete their study? Well, the scientists looked at emergency department records from more than 4,000 facilities across the US from the National Syndromic Surveillance Program, or NSSP, which is like a team of disease detectives that's always on the lookout for signs of sickness spreading across the country. The facilities were grouped based on the US Department of Health and Human Services regions that can be seen here. The scientists looked specifically at asthma-related emergency department visits because smoke inhalation can make existing conditions like asthma worse, like we already talked about. The scientists also looked at continuously collected data on air quality from the Environmental Protection Agency, or the EPA. They then identified wildfire smoke days in the three regions. This means that over a 24-hour period, at least one location in the region had an average PM 2.5 concentration that corresponded to an air quality index, or AQI, over 100. The EPA defines anything above this level of pollution as unhealthy for sensitive groups like children and older adults. After collecting all this data, the scientists compared the actual number of emergency department visits during wildfire smoke days with the number of emergency department visits they expected, which they figured out using statistics. So let's talk about what the scientists learned from the study. Overall, during wildfire smoke days, asthma-related emergency department visits were 17% higher than expected. These visits were more common for 18 to 64-year-olds compared with children and older adults. There was a strong correlation between additional asthma-related emergency department visits and wildfire smoke days. This means that when there were more wildfire smoke days, there were also more emergency department visits. But remember that correlation isn't the same as causation. Scientists don't know for sure if more wildfire smoke days caused the increase in emergency department visits. So let's look at a graph to see what all this means. And let's take Region 2, New York and New Jersey, as an example. On the x-axis, we have time during the Canadian wildfires, April through the end of July. On the y-axis, let's start with our particulate matter and corresponding AQI. Remember, that stands for Air Quality Index, and anything above 100 is defined as a wildfire smoke day. Now, the graph looks kind of like this until we get to about June 5th, when the AQI spikes. And then there's a smaller spike around June 29th. Now let's look at visits to the emergency department mapped on top. You probably guessed it, they correlate to the wildfire smoke days pretty well. And in fact, this region had the largest increase in additional visits to the emergency department during this time, with a whopping 364 extra visits. So what does all this mean? These results show that people are experiencing health problems related to exposure to wildfire smoke. Those health problems significantly impacted emergency department visits. In the future, public health experts should consider using asthma as an indicator of the impacts of wildfire smoke days. Having a good correlation between the two means that it's likely a fairly reliable indicator. Now, with any study, we need to consider any issues there might be. For this study, there are 4 potential issues to consider when looking at the data. 1. Particulate matter and AQI can't be directly attributed to wildfire smoke from Canada. Again, this study suggests a correlation, but does not test causation. 2. The National Syndromic Surveillance Program may not be nationally representative because participation in the program varies by region. 3. Data for the study only included emergency department visits from the National Syndromic Surveillance Program. The scientists didn't look at other healthcare settings like urgent care or primary care. This could actually underestimate the impacts of wildfire smoke on public health. And 4. The definition of wildfire smoke days might not actually capture the full spectrum of pollution that can cause health issues. Any of these 4 could result in an underestimate of the effects of wildfire smoke on public health. Let's talk about the big picture now. Wildfire smoke exposure is going to continue to increase because of climate change, land management practices, and urban growth. Exposure will also happen in areas that traditionally aren't impacted by wildfire smoke. So, what can you do to protect yourself from wildfire smoke? Well, be aware of the air quality in your area. You can check this using the EPA's website, airnow.gov, if you live in the US, or waqi.info if you live outside the US. Make sure to stay indoors when the air quality is unhealthy for sensitive groups or worse. Also, you can use air filters in your home if you have them. And if you do need to go outside, make sure to wear a mask. An N95 mask should protect you from PM 2.5. Thanks for joining us. This research was published in the Morbidity and Mortality Weekly Report, MMWR, prepared by the Centers for Disease Control and Prevention on August 25, 2023. Research was conducted by Kristen McArdle and others from the CDC, IFC International, the Oak Ridge Institute for Science and Education, and the Environmental Protection Agency. See the original article for additional author information. MMWR is often called the voice of the CDC and is the agency's primary vehicle for scientific publication of timely, reliable, authoritative, accurate, objective, and useful public health information and recommendations. And it's a free publication that's available to the public. MMWR readership predominantly consists of physicians, nurses, public health practitioners, epidemiologists, and other scientists, researchers, educators, and laboratorians. We hope you learned something today. Have a good one.